Question number 10, the Honourable Annette King.
Thank you, Mr Speaker. My question is to the Minister of Health. Are patients receiving through New Zealand's healthcare system the healthcare recommended by their medical practitioner? If not, why not?
The Honourable Dr Jonathan Coleman.
Mr Speaker, yes they are, and there have been remarkable improvements over the last 6 years. This is reflected in the extra 50,000 first specialist assessments and 44,000 elective surgeries that are now being delivered each year compared to 2008. Patients who are recommended for cancer treatment are also receiving that faster and without being flown to Australia, as was the practice prior to 2008.
Supplementary question.
Supplementary question, the Honourable Annette King.
If patients are receiving the care their medical practitioner recommends, why did GP Dr Tony Farrell from the Bay of Plenty come out publicly on Saturday and say people whose x-rays show bone on bone and were in terrible pain were not being seen in a timely manner?
The Honourable Dr Jonathan Coleman.
Well, Mr Speaker, GPs don't direct treatment. They seek a specialist opinion from a surgeon at the hospital. Now, when they put that referral in, there might be various reasons why there's not actually a specialist appointment or a surgery. The information might be incomplete, there might be a need for further testing, or it may be actually that condition, like bone-on-bone arthritis, is better treated in the community. So the situation is exactly not what she represents it as.
Oh, supplementary question, Mr
Supplementary
Speaker.
question, the Honourable...
Has he replied to Mrs Logan, who wrote to him on the 17th of April asking why her husband has to live with an internal catheter for the past 7 months, which has blocked 9 times with severe effects on his health and daily life, and still doesn't qualify for elective surgery?
The Honourable Dr Jonathan Coleman.
Well, Mr Speaker, obviously I'm not familiar with that individual case, and as Annette King said when she was the Minister, it's better to help people than to use them. But that notwithstanding, if Mrs King would like to send me the details of the case, I can look into it to see what the real truth of it is.
Oh, supplementary question, Mr Speaker.
Supplementary question, the Honourable
What
Annette
was
King.
his response to Mrs Leota, who wrote to him, the Prime Minister, and her local Member of Parliament 3 weeks ago, highlighting the number of people in Invercargill living, quote, with extenuating pain because they don't have enough points to qualify for a hip operation, and she asked for urgent action?
The Honourable Dr Jonathan Coleman.
Mr Speaker, well, if the member just waits to 3:30, she might get a very nice surprise as to what's happening in the community for people with orthopaedic hip pain.
Very good.
Supplementary question.
So it's working, is it?
Order. Supplementary question, the Honourable Annette King.
What reply did he give to Grey Power Hastings, who wrote to him and the local Member of Parliament, Craig Foss, on the 4th of March, telling him how concerned they were about the rejection letters older people in the Hawke's Bay were receiving, and asking for, quote, more honesty and fewer weasel words? Why pretend you can offer a service that you can't?
Well,
Honourable Dr Jonathan Coleman.
Look, Mr Speaker, in the Hawke's Bay, the percentage of first specialist appointments has increased by 41% over the last 6 years, and there's been a major uplift in elective surgery as well. There's been an extra 1,278 operations performed each year. So I'm sure if the former minister goes and asks her close relative, the COO of Hawke's Bay District Health Board, she will be able to hear the truth, because I'm sure this information is not being leaked by him. Surely not.
Point of order, Mr Speaker. I'm wondering who I have to ask.
Order.
Who do I have to ask?
That's not a point of order. If the member wants to have a supplementary question, use it.
Yeah.
Supplementary question, the Honourable Annette King.
Point of order, Mr Speaker.
Point of order.
The member asked a question of me. What is my response to that? He said to go and ask the CEO of Hawke's Bay.
Order. The member resume his seat.
No question was asked. I made a statement.
Order. I was unaware of any question asked either, but if the member wants to ask a question, she's got the perfect opportunity.
No, I want to make a point of order.
Then we'll have the point of order.
I would like to make a point of order and say, did the Speaker hear my question? I asked what was his response to Grey Power. Nothing to do with how many operations that were done.
No, the question, in my opinion, was addressed. I think when you put down a primary question like that and then you list a whole lot of potential correspondence that have come out of the office of a minister over the last 2 months, it's not unrealistic that he cannot recall the content of the letter. Question number 11.